Alright, good afternoon once again and welcome back to my channel. I still remember my humble self, MLS Jonah Josiah. We are here this afternoon to carry out a test known as Serum creatinine. Here with me is the reagent we are going to use. This is the creatinine. This is the machine we are going to use. It's known as semi-auto chemistry analyzer. These are our tips. Automatic macro pipette tips, and these are the tips I'm going to use. This one is from 0 to 50 microliters, and this one is from 100 to 1000 microliters. This is our sample. I've centrifuged it. You can see the serum there, and these are the tools I'm going to use. These are the tools I'm going to use. Let's get started. These are the reagents used. Here with me is the creatinine reagents. The second one is picric acid reagents. Now you add 500 microliter of your creatinine reagents because you are adding equal volume. The first tube is our blank, the second tube is our standard. The third tube is our test, which contains our sample. We are adding 500 microliter of our picric acid, picric reagents, picric acid reagent. You add 500 to our reagent blank tube, to standard and to test. This is our standard. You can see the standard concentration is 2 milligram, and this is the interface of our semi-auto chemistry analyzer. You select the parameters, which is creatinine. You first of all clean by washing using distilled water, or you use 0.5% hypochlorite. You zero the machine. You are trying to zero the machine, you can see. So after zeroing the machine, you can see what it shows there. You now aspirate your blank. You aspirate your blank, because it's a colored solution, so you must adjust the brain of the machine. As you can see, we are testing blank, and it will take 60 seconds, that is 1 minute, for the blank to stop running. You can see the interface. Now we are adding 100 microliter of our standard reagents to generate factor. You see, you click on standard, immediately you add your 100 microliter of standard reagent, you aspirate. Because it's an enzymatic method, it is not an endpoint method, so the incubation is done within the machine. Unlike endpoint method where you incubate sometime at room temperature, or sometime you'll be asked to incubate at 37 degrees centigrade. You can see. Once the machine stops finish testing, you will discover that the factor generated will reflect on the interface of the machine, as you can see above. Then we are now running standard as our test. We are running standard as our test. So you click on test. After adding, you aspirate immediately, because it's an enzymatic method, as I said previously. You can see the interface, the delay time and the testing time. This is our testing time, 60 seconds. The delay time is 30 seconds. That is 1 minute 30 seconds. You can see our standard, 2.94 milligram per DL. Now we are trying to run our sample now. This is our serum. Take 100 microliter of our serum. You add to the already prepared reagent that contains the picric acid and our creatinine reagent. You add, you mix, immediately you aspirate. You can see we are aspirating. We are aspirating. You can see the value of our creatinine here is high. That shows that the patient is suffering from kidney infections. Is suffering from a severe kidney infection. You can see the value of our urea also. I'm going to make a video where I'll give a breakdown of how to run urea. Now, before you turn off your machine, you must click return. The machine will ask, do you want to wash? You click yes. Then you wash using distilled water or 0.5% hypochlorite. Thank you guys for listening.